We all know about childhood immunizations, all the shots that our kids need to be able to enroll in school, unless we have exemptions. What about adult immunization? Adult immunizations. What kind of immunizations do we need as an adult? Well, it depends on your age, to be honest with you. When we classify adult, anybody 18 years of age and older classifies for adult immunization categorization. At age 18, a lot of young adults who are transitioning into adulthood are leaving high school and heading off to college. One of the main immunizations that need to be administered, and if has not already been administered and updated if it has, is your meningococcal vaccine. That's the vaccine against meningitis. There is a big outbreak on college campuses and places where young people tend to accumulate in very close quarters in large numbers. College campuses, dormitories as they pertain to military service, where you have military recruits all bunked up together. We see clusters of meningococcal meningitis in those environments. So we got to be sure that our young adults are being immunized properly to prevent this sometimes fatal illness. The consequences of meningitis can be quite severe, even death. It can cause blindness, it can cause severe debility and destruction of nerves and damage to your brain. So an immunization is all it takes to prevent it. It's well worth it. Other adult immunizations that are very important as we get older: pneumonia vaccines, pneumococcal vaccine, as well as our shingles vaccination. All of us who are over the age of 50 did not get the varicella vaccine as kids. It wasn't in existence when we were kids. So as a result, the majority of us over the age of 50 have had chickenpox as kids because we didn't have an immunization to prevent it. If you had chickenpox as a child, that virus that causes the chickenpox never goes away. After you get the chickenpox, those viruses go and they hide into what we call nerve roots in the spinal cord. As you get older and your immune system becomes a little bit less robust, those viruses can become active and they'll actually travel down whatever nerve that is attached to the nerve root that they've been hibernating in and cause shingles. Shingles is an eruption of a skin rash that is intensely painful, and it'll follow the pattern in the skin of where that nerve innervates or where that nerve ends up on the skin surface. We can prevent that, however, at least decrease the incidence, and if you do have an outbreak, it'll be much less severe than if you were not immunized. So it's really important to get your shingles vaccine. It's a series of 2 vaccinations. You get one, then 2 months later you get the second one. You need to have it after the age of 50, and you can get it all the way up to the age of 80. It's very important. Shingles can be quite debilitating, particularly if you get shingles in your face, or what we call ophthalmic branch shingles, where the virus can actually get into your optic nerve and cause blindness. It only happens on one side at a time, but it can be very, very painful and quite debilitating. Well worth getting immunized against. The one nobody ever wants to hear about at this point is the flu vaccine. The flu is still alive. It's still quite dangerous in terms of people who are in susceptible age groups. Little children, elderly people, people with comorbid medical conditions like diabetes, cardiovascular disease, and HIV and AIDS, or if they're on immunosuppressive drugs. Patients who are under treatment for chemotherapy for cancers are very much at risk for severe illness if they catch influenza. Influenza mutates cyclically, which is why every year it's very highly suggested that you get a new immunization, because what you may have been exposed to the previous year may absolutely not provide you any natural immunity in the following year. The CDC generally does testing in China in the summertime of every calendar year to find out what strain of influenza is likely to make it to the United States by the fall. And then they develop a vaccine that's specific for that strain of the influenza virus. It's important that you get your yearly flu vaccine, especially if you're in a high-risk category, as we described earlier. And then lastly, this is the one that nobody really wants to hear about, and that's COVID-19. COVID-19 is still out there. I worked in the ER last week, diagnosed 2 cases. Fortunately, both of those cases were in people who had been immunized, and they had very mild disease, did not require hospitalization, and were able to be discharged home on just standard treatment. Now, who needs to be immunized for COVID-19? Right now, the CDC says everybody who has had their first 2 shots, and even if they've had that first booster shot, but not gotten that bivalent vaccination, should get that vaccination to protect you against the Omicron variant of COVID-19. So if you've not received that, you receive that. That's for the general population. Patients who are in high-risk groups, though, people over the age of 50, people with chronic diseases, people who are on immunosuppressive drugs or have immunosuppressive or autoimmune disorders should get a bivalent booster every year, usually in the fall around the time when you would get your influenza vaccination. It'll help prevent you from having serious illness. COVID-19, although it's no longer in a pandemic state, is becoming endemic now around the world. So it's circulating all the time. It's being passed from person to person. And because we have so much now combination of natural immunity and vaccinated immunity, we're not seeing as much serious illness, and we're seeing more asymptomatic cases where the spread is being undetected until it reaches somebody who is in a more susceptible state. And those people still can become quite ill. So if you're in a high-risk category, make sure you're getting your yearly booster for COVID-19. I hope you like the content that we're putting out. I want you to hit the subscribe button so that as we continue to roll out new content, new topics, you'll get a notification, particularly if you hit the bell. Hit that bell notification and you'll be among the first to get notification when we put out some new content. Also, as many likes as we can get, it helps us a great deal with respect to our YouTube algorithm, helps us move up so that when people are searching for information on the topics that we discuss, we'll pop up and they'll be able to get up-to-date information. Once again, God bless you and stay safe.